pathway and the diagnosis of diabetes. First, we will talk about the insulin signaling pathway. Now, the insulin molecule mainly acts on three types of tissues. That is the skeletal muscle tissue, the adipose tissue, and the hepatocytes present in the liver tissue. Now, in these tissues, the insulin molecule binds with the insulin receptor, which is belonging to a family of tyrosine kinase receptor. Now, after binding, insulin brings about changes by two types of pathway. First is the mitogen activated protein kinase. As you can see, the insulin molecule first binds with the receptor, then it activates the SHC protein, which ultimately causes a cascade of reaction, which ultimately leads to cell proliferation, differentiation, and survival. Now, we will talk about the inositol triphosphate kinase pathway. Again, the insulin binds with the insulin receptor, which activates the insulin receptor substrate, which again causes a cascade of reaction, which ultimately causes various effects, which include, first of all, is anti-apoptosis. Secondly, it causes protein synthesis and lipogenesis. Thirdly, it is also responsible for increased glycogenesis. And lastly, it causes increased mobilization of GLUT4 receptors towards the cell membrane, therefore allowing glucose molecules to enter the cell and therefore allows energy production. Now we will talk about the diagnostic criteria of diabetes. First of all, we have to talk about a normal subject. In a normal subject, there must be no family history of diabetes mellitus. The fasting plasma glucose level must be between 70 to 110 mg per deciliter. The postprandial glucose level must be less than 140 mg per deciliter, and the HbA1c level should be less than 5.7%. Now, when we are talking about patients, we mainly classify them into two types. First, we classify them into a pre-diabetic. A person is said to be pre-diabetic if the HbA1c level is between 5.7 to 6.4%. The fasting plasma glucose level is between 100 to 125 mg per deciliter, which is a case of impaired fasting glucose. And the postprandial glucose level is between 140 to 199 mg per deciliter, which is a case of impaired glucose tolerance. Now we will talk about a diabetic patient. In order to be classified as a diabetic, the patient must have HbA1c level greater than equals to 6.5%, or the fasting plasma glucose level must be greater than equal to 125 mg per deciliter, or the postprandial glucose level must be greater than equal to 200 mg per deciliter, or random plasma glucose level must be greater than equal to 200 mg per deciliter, and the patient should also show symptoms of diabetes. Now I will hand over the mic to Samila.